Trying to come up with the nose. Oh my gosh. What is this struggle? What is this camera struggle? I need like a tripod or something because she's getting popular and professional over here. All right, so I just finished orientation on Zoom. Let me make sure that I logged out. And it is now 8:46 and I don't have to be back, or I don't have to be at the clinic for orientation until 10 a.m. So I'm gonna file down these nails because they're a little long. And then I'm going to have some coffee, pack some lunch because I have a full day today. I am basically not going to be done with clinic and with other school responsibilities until 9 p.m. So I probably won't get to work out today, but that's okay. Rest and getting oriented comes first. So yeah, I will check back in. This first week, I'm just gonna be at the clinic, and I'm going to spend a lot of time at this clinic. Tomorrow I have a half day in the neuro and headache center, so that sounds fun. Gotta prepare for that, and I only have a half day tomorrow, so I'm gonna enjoy some rest. But yeah, I'll keep y'all updated. Bye. What's up, everybody? Welcome back to my channel. So it is currently 12:43. I just got out of the headache clinic. Made myself a little PSL because the ones in the stores are that was totally unnecessary information, but there you have it. So today I spent half of my clinic day in the neuro and headache clinic, and I am just so impressed that Botox is a treatment for migraines. What? I'll say it again. Botox is a treatment for migraines. So basically people with migraines are getting a twofer. You know, they're like getting lucky because not only are they getting Botox on their like forehead area to relieve the pain from the migraines, but they're also getting snatched. You know what I mean? And like, I'm a very expressive person, so I feel like
in my near future,
I am going to need
that.
And another thing that I found cool was that this was a family medicine physician. So family medicine doctors can basically just get certified. They just have to have someone to teach them how to do Botox, and bada bang, bada boom. So I thought that was freaking cool. Yeah, we just saw a lot of headache patients today that came in with severe headaches, and then they would get either the Botox or they would get nerve blocks. So they would get like needles into here and they would block that nerve. It's called the occipital nerve. So they would block the occipital nerve back here, and that has two different kinds of anesthetics. It has lidocaine, which works almost immediately, like within 30 seconds, and bupivacaine, which takes a little longer, but it does work for a longer period of time. So, you know, you would go into the room and everything was like dimly lit, which I thought was really cool because people with migraines usually have like photophobia, or like they can't stand to be in rooms that are bright because that exacerbates their symptoms. So I thought that was really cool, the dim lighting, and then the fact that almost immediately their headache that was originally an 8 out of 10 on the pain scale was now down to like a 2, and sometimes even gone before the visit was over. So I thought that was really cool. And then we did a quick neuro exam on a new patient, so I thought that was cool. Failed almost every single one of the questions that the physician asked me, but I was like, yeah, I'm kind of embarrassed that you know,
when push comes to shove and you ask me a bunch of questions, I failed everything.
And he was like, you're a third-year medical student. Family physicians wouldn't even know the answers to half of those questions, so you're fine. So it's just interesting. I'm sorry that this was just here in your face, that you can't have any because it slaps.
I love PSLs, oh my gosh.
So yeah, that's basically what happened today. And then I have this afternoon off, so I'm going to finish editing the pediatrics video because I haven't uploaded that. I haven't even like worked on editing it, so I'm gonna do that. And then the rest of the week I'm at the FHC at the Family Health Center, where the MAs and the nurses are currently on strike, so it's been a little bit of a madhouse. Yesterday was my first day, and it was a bit of a madhouse. So we'll see how the rest of this week goes, and I'll keep you posted, fam. Welcome back to my video about family medicine. Just here trying to give y'all an update on how I've been doing, the things that I've been up to, how I've been doing, like I said. Okay.
Maybe I should move.
This has taken me like probably 30 minutes to come up with a good angle because there's so many awkward...
You don't care.
It's taken me forever to find the good angle, and I don't even know if this is a good angle, so hopefully it is. All right, so now finally let's get to the update. I did write some notes that I kind of wanted to update y'all on, and all I want to let you know is that I am having such a blast on family medicine. It has been pretty gnarly because I feel like this is what it feels like to be a doctor, like the stereotypical doctor that, you know, you kind of grew up going to, or that you kind of think of, because, you know, like right now I'm being like I'm following around family medicine doctor. So it's, you know, general medicine. It could be like depression management for one patient, and then the next visit could be pregnant ladies. And then you could have another one where it's just like a pediatric child check. Pearl, you are blocking the camera, Pearl. So yeah, I kind of wanted to touch base and tell you some of the things that I've been seeing. I did do my 1 week of inpatient, which was super exciting because it was the 1 week where I was in the hospital from like 5 a.m., actually like 6 a.m. to probably like 5 or 6 p.m. So I was there pretty much all day, every day. I did get the awesome experience of working with my partner some of those days, which was pretty cool. Being there, I hadn't really been exposed to like the ICU or anything like that. Even when I was a phlebotomist or a CNA, I never was really exposed to patients that have been intubated and, you know, like aren't responsive. So I saw my first patient at the beginning of the week, and he was completely intubated. And when we went to go kind of discuss with the family the next steps, like what they wanted, because they had tried weaning him off of the ventilator, and he was not responding well to it. So I witnessed, you know, the doctor and the resident, the attending and the resident kind of talk to the daughter, and kind of ask her, you know, like, what do you want us to do? Your dad's not really responding to getting weaned off of the ventilator anytime soon. So, like, what are the next steps? As the power of attorney, what do you want to happen? So it was really sad because obviously the daughter was devastated, and I just put myself immediately in her shoes and just thought about my own father and how difficult it would be to see him in a situation like that. And it really broke my heart. And, you know, he was just there with a tube down his throat, like plugged into a machine, and he would move, like he would jerk his legs a little bit here and there, but not too much. So that was a little sad. That was a little much. And as the week progressed, he started getting better. And I think in not the next day, but probably like 2 days later, he finally got weaned off of the ventilator. He got extubated, and apparently he was like fine. So I went to see him a few days later, and I was like, hi, we met before, but you were not awake. And, you know, I just wanted to introduce myself. I just want to let you know how happy I am that you no longer have a tube down your throat, that you're breathing on your own, and that you're having, that you're progressing, that your symptoms are getting better, that essentially you have no symptoms right now. So it was a really cool experience for that to be my first patient in the hospital world, because like I said, I didn't really have a lot of in-hospital experience besides an OBGYN, because of the mess that was my pediatrics rotation.
But we ain't gonna talk about that.
Another thing too was that when I saw that patient, I didn't have to do like any physical exam or anything with the patient. So the next day, there was a patient that they asked me to go see. They asked me to go check the heart and lungs and kind of just, do an overall checkup of the patient, and then go report the findings to the intern and to the attending. And basically, it was my first time doing vitals on someone that was not conscious, with like a tube down their throat on a ventilator, and I didn't really know how to go about it. So, and my partner was witness to this, and so was the intern. They were like, okay, listen to her heart and lungs or whatever. So I did what I felt comfortable doing, and I said, hello, so-and-so, my name is Noemi, and I'm gonna check your heart and lungs, okay? And it brought peace to me. Like, I know that she's probably unconscious, and I know that she probably can't hear me, but it just brought peace to me knowing that I introduced myself like she was any other patient and told her what I was going to do before I did it, like I would any other patient. So that was just like a little thing that was kind of like, oh, I don't know what to do. Like, do I just go for it? And that didn't feel right, so I just introduced myself, and it might have looked a little silly, but that's what I felt comfortable doing. Another interesting case that I had with a patient was that he had this cancer called multiple myeloma, which is a pretty aggressive cancer. And he had been treated with steroids. So his body was pumped up so much on steroids that it ended up giving him diabetes. And I think that is something that I didn't really grow up being exposed to, I just thought like, oh, you have cancer or you have diabetes, and they're two completely separate things. They're not like caused by one or the other, but I just think that these instances are very interesting where, the therapy or the treatment for one illness causes something else, causes another adverse side effect. And this is kind of what we see in the older populations when they have like hypertension and diabetes, and artery disease and all of these different chronic illnesses. And you see them having like their pill boxes or so many different medications that they're on. And it's because of things like this, where, the effects of one medication treating one illness causes you to have all of these reactions that need a different medication to kind of counteract those things. So I think that's something that not a lot of people think about, or that I didn't really think about. So I thought that was super interesting to touch on. Besides that, like, my inpatient experience has been a little bit limited just because we've had a big surge of COVID cases here in the county where I live in. I think it was like back up to 10% of a positivity rate. So the people that were getting hospitalized were COVID positive, and as a student, like, we cannot see them. So that kind of sucked a little bit, not being able to like see the course. But there is a new treatment right now called remdesivir. I have to do a little bit more research on that, but that is currently what they're using, in case anyone was wondering. And I thought that it was like ultimately cool being at the clinic. Like, one day I started off seeing a bunch of pregnant patients in the morning, and then later on I witnessed the intern give her first knee injection ever, which was awesome. And then we were discussing with the attending one of the pregnant patients, we were discussing gestational diabetes, or diabetes that you get in pregnancy, basically. So she had me do like a mini presentation on that, and it was an attending that I'm terrified of, but she's amazing. She's terrifying, but like, I'm in love with her.
Because I want to be like her when I grow up. She is so good.
But anyway, so I did like that presentation, and every little thing I would say, she would clap back with like a question that I always had the answer for, and that just feels so good. Because I think that, like, we have, as people of color, as underrepresented minorities in medicine, sometimes we have imposter syndrome. Not sometimes, most of the time we have imposter syndromes where we don't really like trust our gut, we don't trust ourselves, we think that we know nothing, and that we think that we're here just because we're brown. Because a lot of people do think that, unfortunately, that we're just here because they give us a free pass for being Latinx, or for being Black, or for being Native American, and that's really not the case. you know, we still worked hard. We took the same exams, we took the same classes as our white counterparts, and that counts. And you know, we shouldn't have to feel like we're not enough or that we're here by mistake or by chance, but unfortunately that is the reality for a lot of us. And wow, I totally didn't think I was going to be talking about that today, but here we are. So after that, after I did like my mini presentation on gestational diabetes, I was able to see the intern do her first ever, I'm sorry, I don't work with interns,
What am I saying?
second year resident, because we can't work with interns. So second year resident, I saw the resident do her first ever punch biopsy on this lady. So that was pretty cool to watch. And I also had a discussion about birth control with another patient and discussed like abnormal bleeding that she was having, and, you know, just be able to kind of counsel her on that. And that was all in one day. So I think that it's so awesome that I saw a variety of patients like that all in one day. So I don't know, man, family medicine, it's pretty cool. Pretty cool. I'm loving it so far. My partner said that when I would get here, I would, you know, this is a rotation where like you feel the most like a doctor because you get to do so much. And I really have been. Like, I've been seeing patients on my own, you know, I've been kind of discussing the plans with the residents and the attendings. So it's been really cool seeing a variety of things, finally learning hands-on. Family medicine is probably on my radar now. Never thought I would say that, but here we are. And yeah, I think that's pretty much it for my update. I might bring in a special guest, but you might have to stay tuned. All right, fam, have a great rest of your day, and I will see you on the next one. Bye. A long day of doing things, about to unwind, about to take off my makeup, and call it a night.
Like I said, unwind.
But anyway, I wanted to let you guys know that I'm actually filming a part 2 to family medicine because I think it's super important to see the dynamic between my partner and I, and how we work together, and how we're both interested in family medicine. And yeah, I think just tackling on fun facts about that, and I decided to make a part 2. That's why this video is a little bit on the shorter side. So stay tuned for that. As I said again, friends and family, thank you so much for watching this, and I'll see you on the next one. Bye.